All right, so the moment that I think, have all been waiting for is finally here where we get to give Walter a happy ending. So that's the topic for our patient focused care discussion, too. So there are many examples throughout his story in which he unfortunately fell through the cracks. But for the purpose of this assignment, I'll be choosing two specific examples which could have been approached differently utilizing patient focused care. That would have, offered a different outcome and as well as contribute some resources or things that could have been put in place to assist him, as well as the role of a PN in these situations throughout. So, for the first specific example or situation that occurred, um, the one that I chose is one that initially stood out to me when reading this scenario, and it's where when Walter stated how he would frequent the ER since his family doctor wasn't always accessible. However, he often endured long waits and became very frustrated because he encountered staff that spoke too quickly or used language and terminology that he didn't understand. And Walter even repeatedly reminded them that English is not his first language. However, these reminders didn't get him anywhere, and the trajectory of those interactions didn't change. So now when we think about patient-focused care and break down the four core principles, it's quick to see that it wasn't being utilized in this scenario. Since this was a specific interaction amongst healthcare providers, I'm going to apply the four core principles to this scenario and dissect how this interaction could have been different. So, the first core principle of patient focused care is dignity and respect. And this is when we need to listen to the patient and evaluate their values and beliefs and emotions and accommodate those into their care. We also need to acknowledge culture and how culture can affect care as well. In this case, we know that Walter is a Métis man, and it's also known that English isn't his first language. So, off the bat, by not accommodating his cultural differences and need for a different communication route for him to understand, patient focused care isn't being implemented. So, this could be remedied by actually listening to Walter's request to speak more slowly, or when reminded English isn't his strong language, a translator could have been set up for him so he could contribute to this discussion and understand the information. So, it's important his values and culture be implemented into his delivery of his care for it to be patient focused as well as effective. So the next core principle is information sharing. And the key to this is that it's done in a timely manner and that we're asking the right questions. So the specific example from the scenario that I've given doesn't go into great detail of the exact conversation exchange. However, information sharing involves communicating effectively amongst not only the patient but healthcare providers as well. And although Walter may have been receiving, like accurate information, it's not being presented in an effective way in which he can understand it, which is warranting it pretty useless. So Walter needs this information shared in a different way for it to be effective. As just discussed, the language barrier needs to be resolved. The next core principle is participation. So now, how can one participate without having an effective understanding of their health? How can one participate when they're exhausted from sitting in the ER all day? How can Walter participate when he is so rushed he doesn't have time to grasp the information that's being presented to him, let alone respond to it? So, participating from patient and family is essential in patient focused care, as without the patient on board with their care plan or not understanding their health diagnosis, it makes it very unlikely for them to be compliant in any treatment or interventions that may be put in place. So, he was not encouraged to contribute and participate in this specific interaction. And then the final core principle is collaboration. So it's pretty clear collaboration was lacking in this situation. There's no evidence of healthcare providers working together to help Walter with his numerous chronic illnesses or acute symptoms that he showed up to the ER with. Nor was Walter given the opportunity to work with healthcare providers for his own care. As mentioned above, when referring to participation, someone is much more likely to be compliant with treatment if they, number one, get to assist in formulating their care plan, but also, number two, just understand what it is about them that's requiring care and how to go about doing that. So now, um, some things that could have changed to implement patient focused care for Walter in this specific example and offer dignity and respect, facilitate information sharing, allow Walter to participate and demonstrate collaboration would have been altered communication route and accommodating his care how he wanted it delivered. So basically, that's the definition of patient focused care. This would have facilitated his understanding of his health status and therefore allowed him to be an active member of the care team and planning his treatment, and therefore much more content with the healthcare interaction, and also less likely to make a return appearance if all of his concerns were consulted and remedied on that one visit. or at least beginning to be remedied on that one visit, acknowledged. Rather than walk away frustrated and return in a few weeks with the same issues but worsened, it would have set him up for success had he been better accommodated culturally and with patient focused care in mind, as I've just highlighted. So, to identify the role of the PN in this scenario and how it could have contributed to a better experience for Walter, so I think a key role for PN in this specific scenario would have been advocacy. So advocacy is essentially speaking on behalf of someone and vouching for a patient when there is change or something that change that needs to occur that otherwise isn't happening. So advocacy is needed in this scenario because Walter isn't understanding how the healthcare providers are speaking to him, which is putting him in a poor position to care for himself independently when he leaves the ER. So it's most certainly jeopardizing his health. And when someone's health is in jeopardy, it perfectly warrants advocacy. So Walter voiced to the health professionals that he wasn't understanding what they were telling him, as English wasn't his first language. And this is where a PN could take on this advocacy role to get an interpreter in place for Walter, or even advocate for him to get more time or a more private or quiet location to speak to his healthcare providers. And encourage the healthcare provider who is providing him care to eliminate any jargon or complex medical terms, so he is better set up to understand. Either way, Walter speaking for himself wasn't enough, and reminding them that English isn't his first language. So it was definitely warranted for the PN in this situation to be an advocate and be assertively professional to get accommodations made for him so his health information could be shared in a way that he can understand. Not only would this facilitate patient focused care, but also culturally competent care. So, to identify a second specific example that occurred in this scenario, so I wanted to highlight the fact that Walter has chronic kidney disease, needs to travel 3 times a week to Prince Albert, which is 4 hours away for his hemodialysis, and he does not have a vehicle, nor does he live with someone who does. Make this make sense to me. It's stated in this scenario that he can occasionally get a ride to Prince Albert with a friend or a relative, but frequently hitchhikes instead. And not only does he spend most of those days traveling, he is no doubt exhausted from the hemodialysis, and this becomes extremely costly for him as not only is he contributing gas money to those who assist him in driving, and not to mention how dangerous hitchhiking is in this day and age. His hemodialysis appointments made it challenging for him to make appointments with his family doctor concerning other issues, as the schedule often conflicts. So nothing about this scenario is patient focused. When we think about what makes care patient focused, it's accommodating the patient's needs in a way that they want and considers their preferences, values, and culture. For example, since rather than a specific interaction, as I mentioned for my first example, since this is a larger chunk and something that would be altered in his care plan, rather than going over the principles of patient focused care, I'm instead going to go over the process, discuss the process of patient focused care. So the process that can be followed in patient focused care is identifying concerns and needs, making decisions, caring and service, and evaluating outcomes. So to start with identifying concerns and needs, Walter needs to be consulted. His collaboration and participation is needed here in making this care patient focused. So asking him something like, "What are your concerns?" may elicit a response along the lines of, I don't know how I'll get to all these appointments. It's so far away and I don't drive. And this is a need that we would only know exists, or that we would only know needs accommodating by asking. So next is making decisions. So, I mean, given that this need has now been identified, research needs to be done to see what services may be in place. Things like perhaps Walter is a candidate for peritoneal dialysis that he'd be able to do from home, of course, with the right setup and education. Or if there's a service in place that offers people living rurally a ride to service or a ride service to get to their appointments and home, something that would be for maybe lower income families or perhaps a free service. So we need to present these options to Walter and educate him on the pros and cons of both, and let him make the decision of how his care plan will be. So offer solutions that are better than the current alternative, which right now is hitchhiking 4 hours away to Prince Albert for his appointments and 4 hours back home 3 times a week. So I really think that any alternative would be appropriate compared to that. So following that is caring and service, the next step in the process, which is aimed greatly at building that therapeutic relationship and instilling trust in the care. So this can be done by clearly showing that you have the patient's best interest at heart and giving them that space. to make the decision themselves rather than kind of force what you think is best onto them, allow them to make that decision on their own. So we will respect and continue to support Walter in whatever decision he makes, following with the cultural competent care I've already mentioned, as well as looking at Walter holistically. So considering things like his culture and his preferences, his other healthcare needs, his emotional supports in place. It's important that we look at it all so we can accommodate it all and show to Walter, we're not just focused on your chronic kidney disease, we're focused on everything else because we know that everything goes hand in hand. We can't just look at one pinpointed thing and expect things to get resolved. And then lastly is evaluating. So we put this resource in place for Walter, whatever he's chosen, and then we evaluate how it's working. So this can be done simply by asking Walter, how have you found your dialysis now since you've, and then just insert change may now. So since you've started peritoneal dialysis, or how have you found your dialysis appointments now since you've been able to take advantage of this ride service? So how are you finding it since we've adjusted? And not only that, but assessment can be done as well to evaluate how the plan is working. Does Walter seem to be managing better or worse since we implemented his decision? And it's important we ask Walter, but we can also assess ourselves just by seeing how it's holding up. So, by the process of patient focused care, we've identified a big concern of Walter's, which we can now work to accommodate and help alleviate a big chunk of that stress he's experiencing. In the initial scenario, there's no identification from healthcare providers of an issue regarding transportation for Walter, to even just the ER, which was still a substantial drive, but not as long as his hemodialysis appointments. Yet, throughout the story as a whole, it was stated on multiple occurrences how much of a concern and an issue it is for him. So he no longer has to burden either the travel cost or potentially the burden of spending the entirety of 3 days each week traveling and receiving treatment or stressing about how he will get there. We're now in a position to perfectly cater our care to your patient in a way that works for him, which we know is perfect for him because we've asked him, and it will have a big positive impact for Walter, which is what patient focused care is all about. So now to identify the role of a PN in this situation, I believe the role would be education. So as healthcare professionals, teaching moments are constant, whether they are planned patient teaching sessions or more spur of the moment. In this case, it's clear that the commute 3 times a week to Prince Albert is challenging for Walter to endure. And this is where a PN can, number one, learn about resources that may be in place to get Walter to and from these appointments, or research his ability to switch to peritoneal dialysis to eliminate travel. Once we present these options to Walter, the teaching begins from there. So we can teach him about perhaps ride or taxi services that offer rides to perhaps people within his circumstance to get to and from his appointments, or if it's peritoneal dialysis, he is eligible for and chooses. A lot of teaching goes with that. And although the majority of it would be given from a specifically trained dialysis nurse or doctor, we can still most certainly be there to support and perhaps ask Walter if he has questions and write them down for the next time he speaks to the dialysis nurse or doctor so he doesn't forget. Either way, we know our patients are more than capable to make decisions for themselves. And when they're choosing their specifically catered care plans, they then will follow these plans better and will have better outcomes. But in order to make big, important decisions, it first requires knowing your options and being educated. And that's where the role of the PN comes into the scenario. So, education is required to make informed decisions. And the role of teaching is one that is ongoing at all points of delivering patient care. And with that, I've rewritten some components to Walter's story that elaborate on where the scenario kind of went wrong, and then different techniques to analyze these examples using concepts learned in patient focused care. Um, so, like I said, for the first one, using those core principles, and then for my second example, aligning it with the process. So I've acknowledged changes that could have been made to accommodate Walter and his needs in a way that he wanted, as well as the role of the PN throughout. Thanks for watching.